Hi, it's Angel Flenner coming to you from inside downtown Mesa, inside the beautiful The Studio Salon, inside my office at the Skin Coach. Today I wanted to talk to you and reach out a little bit about the importance of microneedling, basically what microneedling is used for, and the difference between what I have grown to learn is medical versus cosmetic microneedling. The way that I have learned microneedling is through the teachings of what we know in our field as Dr. Setterfield. Dr. Setterfield published this book called The Concise Guide to Microneedling, and as you can see, it is with using both the pen style as well as the roller style. Now, I personally don't use the roller style with the exception of when I do rolling for the scalp on certain people, but that's about the only time that I use a roller. I originally learned how to do needling through Chris and Dr. Larry Group in Scottsdale. They are the inventors of the Skin Stylist pen and currently own a business called the Aesthetic Advisor Academy. If you'd like more information about them, I'd be glad to give it to you. Just leave me a message down in the message area. Now, when we talk about microneedling, first and foremost, to me, in my studies, microneedling is a form of, I'm going to get this out of the way, it is a form of a controlled injury. And a lot of people will say, when they come in for a treatment, they have expectations of bleeding. They have expectations of being extremely, what they call erythemic, or red in the face when they're done. And unfortunately, that's not the way I do things. So if we can back up a little bit, when you are needling a person, there are different settings on the needling gun or needling pen that we use, and they go from a 0.25 all the way up to some pens have a 3.0. In my opinion, and this is strictly my opinion because I know certain people will have issues with me, cosmetic needling, you're not using a needle that punctures the skin any more than 1 millimeter. Now, a lot of people will hear about microneedling for things like what they call collagen induction therapy. Now, collagen induction therapy can be supplemented by using such things as a stem cell serum, which we do here in my office, and there are other practitioners that use hyaluronic acid. Some people are taught to use just plain old saline solution, and so on. It just depends on the school of thought. Some schools do go a lot longer in their education, where some schools, which to me, unfortunately, only go like a weekend of study. But that's another video for another day. Cosmetic style of needling is only 1.0 and below. Now, that can be something that's done every 4 to 6 weeks of treatment. I will tell you the truth, I don't guarantee any results on people's skin over 60% in just one singular treatment. And I personally like to couple them with stuff like peels and so on, because we're talking about people that want to have more of a glowing complexion, or they want to be free of freckling or slight areas of hyperpigmentation and so on. Now, another thing that people will ask you as far as treatment is the amount of needles in the handpiece they're using. And most needling pens go from a 9 needle, which really, really rips the skin up, all the way up to a 42. I've seen some pen needles have up to 55 needles. So the difference between the two, to me, the more needles that you have, the more aerations you're going to be able to make. Hence, more product is going to be able to be moved into the epidermis where it needs to go to fortify collagen and to give it some strength. Again, there are those that just simply want to go after the inflammatory response, where the body simply makes collagen to fill in areas of the skin where there is surface wrinkling, like around the eyes, in the forehead, down the center of the face, or around the lip line. But again, most success isn't really seen until after you have about 2 or 3 treatments. Now, with regard to cosmetic, we pass that on to medical microneedling, and it's not necessarily a term, but again, in this book, Dr. Setterfield explains the difference between the two. And to me, medical microneedling are things like acne scarring. Using stem cell is perfect in this case. Again, in my office, I use mesenchymal or bone marrow stem cell product from a company called Anti-Age. And my clients also go home with it, so they can be using it at home. Medical microneedling can also mean scarring that people get post-surgeries. I work with a couple of plastic surgeons that I work on their clients after they have had facelifts, after they have had tummy tucks, and they don't want to deal with that shadow scarring after they're all said and done and healed. This is typically a little bit more expensive, and there are different serums that are used that treat the skin. Again, another video for another day, and I will make that because a lot of people have been asking me. Now, my problem with microneedling in the mainstream is that we all remember that one picture of Kim Kardashian. I don't know why in the world that became the mainstay for what microneedling should be done after you have what should it look like, after you have a treatment. When you think about microneedling, you heard me say a little bit earlier that microneedling is a controlled injury. So when you think about injury, there is such a thing as the inflammatory response, or how the body handles an injury. So if you're using good serums, like some people will use copper, some people do use hyaluronic acid, or in my case, using the stem cell. If you're going to cause injury to a person's skin, the body's going to naturally want to respond to heal that injury. So all of the other things that you've used on your skin to needle into the skin are going to be wasted. So the whole idea of people expecting to go deeper into the skin, or are we going to go deeper this time with this treatment? It's, to me, kind of worthless, because the deeper you go into the skin, the more injury you're causing, and the less that the products that you're using for a particular treatment, whether it be acne, whether it be a CIT or collagen induction, or treating for hyperpigmentation, it's going to be worthless. So those good things that you're paying for in your treatment are just going to be wasted, because the body's going to be going after inflammation response. A lot of people also ask me about PRP, or platelet-rich plasma. In my opinion, and through some schooling I've recently had through Anti-Age, it doesn't make sense anymore to use PRP. The reason being is, when you pull blood out of the arm, and how this is conducted is, somebody will come in, they'll withdraw a certain amount of blood from the arm, that blood will go into its tube that it's drawn from into a centrifuge and spun off. The only problem there is you still have particulates of the blood. You still have the idea that where is this coming from in the body? Is there enough regenerative properties in that PRP to really give you what you want as far as results in your skin? If you're using a person that is in their 50s, for instance, and you're using their PRP, it's not really nutritive to use on the skin anymore, versus a stem cell product such as Anti-Age, where the donator is 21 years old, for instance, and you're able to use that with every single treatment. So when you come in and you're thinking about having microneedling, I would highly suggest having a consult. Make sure it's the right treatment for you. It is not for people that have issues with blood clotting and so forth. It's also not necessarily issues for people that have open wounds or active acne with green coloring or slime in their skin. That's what we call it in my practice. And people laugh at that, and we get it. If you have any questions about microneedling, or you'd like some more information about any of the products we use here in my office, just give me a call. Our office number is 480-498-8833, or you're welcome to email me at skincoachaz@gmail.com. If you are a practitioner, or you are a licensed person, whether it be an LPN, an MA, or an esthetician, and you have more interest in microneedling, I highly suggest going out and getting a copy of this book, and perhaps even going on Facebook or Instagram to look up Dr. Setterfield for yourself and find out some of the things that he has done that are good, and the sciences actually behind microneedling and the different things that people microneedle into the skin. Again, that's a question for a different day, and a video for a different day. So have a great week, be Pono, and always remember to pay it forward. Any questions or comments, please post them below. Take care.